Hi, I'm Susan Dreyfus, President and Chief Executive Officer of Families International, the Alliance for Children and Families, and our wonderful group of companies here at Families International. It's nice to be with you again on this video clip. And today I want to spend some time talking with you about work I've been doing over the last couple of years in healthcare reform and why I believe it is so important, whether you call it healthcare reform, whether you call it entitlement reform. I believe this will have a huge impact on America's nonprofit human services sector, and we have to get it right as it relates to vulnerable populations and people who have high health disparity in our communities across this country. When I was Secretary of the Department of Social and Health Services for Governor Christine Gregoire, one of the things that she asked me to do is serve on her healthcare reform cabinet. Through that work, it became increasingly clear to me that we are not going to bend the cost curve of healthcare and have a healthier population in this country until we figure out what it's going to take to meet the biopsychosocial needs of our most vulnerable populations, where 5% of the population served in this country drive 50% of our healthcare expenditure. The federal debt is clear. If we're going to get control of the deficit, it is clear. We have got to tackle this in terms of the rising costs of healthcare and the increasing share that it is taking of our gross domestic product in our country. I believe if we're not successful in doing this, we will increasingly see fewer dollars in terms of domestic spending. So I spent a lot of time working on looking at the vulnerable population groups and figuring out the kinds of partnerships that are going to be necessary between the formal healthcare delivery system and community-based organizations like we have in the Alliance for Children and Families and the United Neighborhood Centers of America. Last week I went to DC. I spent 3 days. It was a whirlwind trip, but I spent 3 days meeting with people that I think are key influencers on healthcare in this country. I met with House and Senate staff. I met with MedPAC, MacPAC, who are in Medicaid, Medicare. I met with the Center for Medicaid, Medicare Services. I met with the folks that are running the dual eligible programs in our country. I met with folks from PCORI, where they're running the patient-centered research here in the country that's a critical part of the Affordable Care Act. And as I came through those meetings, it was clear to me that, first of all, we as a sector need to both see ourselves and be seen as relevant to improving the health of this country's populations, especially our vulnerable populations and those with high health disparity. So as I was having that conversation with them, there are several things that I could tell they're realizing about the power of America's nonprofit human services sector. Not only are we to be critical partners in the delivery of services, whether it's assessment, whether it's case management, whether it's in-home services and supports, whether it's being patient navigators and advocates on behalf of vulnerable, high-cost population groups. There's so many roles that we can play, both locally and nationally as a network, in making our place known in healthcare reform as a vital partner. But I also think there's a whole lot more we bring to the table than just the delivery of services. We bring with us community, our strong community ties, our innovative spirit, the way in which we can take a problem and tackle it with and through the community so that together we share responsibility for improving the health of vulnerable populations. You know, I've been doing this work a long time like you have. I believe it is critically important that whether you call it healthcare reform or entitlement reform, we are on an unsustainable path if we do not figure out a better way to take these precious dollars and spend them in a way that delivers maximum results on the populations that we serve. I think healthcare reform for the nonprofit human services sector could either be one of our greatest opportunities or it could be a huge risk for you all out there if we don't figure out the right positioning for you, both locally and nationally, as advocates, as providers of services, but as innovators and partners in making sure that in healthcare reform in this country, we don't just lower costs, we improve the health of populations and that no one get left behind. I'm forwarding to you with this email, this video clip, an email of my PowerPoint presentation that I used out in Washington last week. I'd like you to take a look at it. I'd like you to contact me and let me know what your thoughts are, what's going on in your communities, and what are ways that you believe we, as a highly effective intermediary on your behalf, can position you in this national network for healthcare reform in the 21st century. So I hope you take a look at it, I hope you enjoy it, but I hope we also stay connected, keep leading, keep visioning and innovating, because right now is a critical time for our sector, not only because of this great economic recession and the impact that it continues to have on our communities and our states across this country, and certainly on our agencies, but also the opportunity that I believe we have that as a country, as we're driving for greater impact, for America's nonprofit human services sector to have never shine brighter than I believe it's going to shine in the years ahead. So thanks for all you're doing. Stay in touch. We'll see you soon. Bye-bye.